Hi. We met before, but again, I'm Anna. I just wanted to say thank you so much for doing this interview. But first off, can you just tell what's your name and tell me a little bit about yourself?
Yeah, my name's Kiera Dye. I currently work at the Ohio State University Wexner Medical Center and the James Cancer Center in the neurocritical care unit as the lead advanced practice provider.
Fantastic. Where did you go to school?
So I did an undergraduate degree at Ohio State in human development and family sciences because I didn't know what I wanted to be when I grew up.
Hmm.
Then I went to Kent State University for their accelerated Bachelor's of Science in Nursing program. I completed that in 2016, and then I worked at University Hospitals Cleveland Medical Center in their neuro step down unit from 2016, July 2016 to July 2018. And then I worked on 8 brain and spine here at OSU. And I went to school, I think starting in 2019.
Hmm.
I started my master's program here at OSU in the adult gerontology acute care nurse practitioner program.
Yeah.
Um, After I graduated from there, I worked at 8 Brain and Spine while I was in school. After graduation, I did the um, APP acute care, critical care fellowship program here, where I rotated through all the different ICUs and then a couple other areas. And then after that year of fellowship, I got a permanent position here in the NCCU.
Fantastic. So you already told me that you're in the neurocritical care unit at
Mhm.
OSU. Can you tell me a little bit about your position, like some of your day-to-day activities?
Yeah. So we start sign out in the morning from the night team at 6:30 in the morning. We get sign out on all of our patients, usually done about 7 a.m. At 7, we go to the nursing huddle just for a safety debriefing, make sure there aren't any hotspots, anything to look out for. We come back, we start chart reviewing, looking at the data in the chart about our patients. Um, and about 7:30, speech, PT, OT, social work, and case management come in, and we do like a quick table rounds to see if anyone needs any therapies or if there are any discharge, disposition, planning items that we need to take care of. Usually starting at like 8 to 8:30, we'll pre-round. So we'll go examine our patients, try to touch base with the nurses, see if there are any orders or concerns that they have. Um, Start rounding with the attending physician between 8:30 and 9 usually. So we go to all the patient rooms, we round with the nurse, the APP, the attending, and then pharmacy.
Hmm.
Um, if able, we like to have the dietitian with us and respiratory therapy if they're able. So we try to do like a multidisciplinary round just based on everyone's availability. Usually finish rounding about noon. Um, and then we just start following up on our plans at that time. So reaching out to consult services, making sure that orders were placed, and then start writing notes. And around that time is when admissions start coming in.
Hmm.
So we'll start prepping notes for the admissions, going to see the patients, um, and then sign out for night team starts at 6:30 p.m. So
Hmm.
we sign out to the night team. The night team workflow is a little bit different, but pretty similar.
Hmm.
So they get sign out, finish at about 7 p.m. We do have decreased staffing at night, so the night team has more patients to take care of
Hmm.
because they don't round or write notes. So usually they're done chart reviewing about 8:30, and they go do like an informal round. So they go see all the patients, do their examination, talk to the nurses, make sure that all the orders are up to date. And then night shift is really just kind of taking things as they come. So as issues arise, handling it, putting out fires, taking admissions,
Mhm.
etc.
Well, fantastic. I know how night shift can be for me, so I
Yeah, yeah.
understand. All right, well, thank you for that. So I guess you mentioned that you do a lot of interdisciplinary rounding, so I can tell that there's already some APRN influence, especially in the healthcare system. Can you elaborate a little bit more? I know that you are kind of higher up in your position and doing more of that, but what is the influence do you think that APRN has in the healthcare system now?
Yeah, the APRN influence is really growing here at OSU. A few years ago, probably like 5 years ago, we didn't have any like management positions
Hmm.
at all. So our influence was very limited and more there was more of a physician influence over everything.
Yeah.
We've really worked hard to start advancing our influence on the medical center. Most recently, we had a comprehensive group, including pharmacy, APRNs, and some physicians that worked on changing the presser algorithm.
Mm.
So we expanded the pressors that can go through a peripheral IV to try and prevent patients from getting unnecessary central line placement to try and reduce CLABSIs.
Yeah.
So that's one thing. We are pretty much involved in every quality initiative that there is. They're really making sure that APRNs and PAs have a seat at the table now because our influence is just growing so much. And especially with the new tower opening up, there are going to be so many more APRM positions opening up.
Yeah.
It takes a little bit longer for residency seats to open up. You have to like go through GME and all that stuff. Whereas for APRNs, they can just create a position. I'm sure there is more to it than that, but it's a lot easier to create an APRN position to fill those needs than it is to like try to go through residency to get resident positions. And then they know that residents are temporary, so
Mhm.
their influence matters, but they know that they're not here permanent. Whereas, like we hope that our APRNs and our PAs are here permanently. So we really try to have their influence. This past year has been really transformative for the APPs. We started um, a critical care boot camp onboarding program. So it's 2 days of 4 hours of like lecture and discussion to
Mhm.
try and help with the onboarding of the critical care APPs. We kind of revamped our procedure classes, so training for procedures. And we've worked really closely with our physicians and our pharmacists um, to really advance the educational opportunities
Mhm.
for APPs in the health system.
Mhm.
Um, physicians they always have different educational offerings to um, enhance their professional development, and we really want APPs to have those same opportunities.
Yeah. And I know that you do a lot with the education topics, especially in the stroke as a stroke center. So I
Mhm.
think that, the higher education, educating nurses and providing more information is really important as well. So we appreciate that. So, you're talking about all of these things that you do and you do very well. Would you say that there are any barriers that you face as an APRN or that you've noticed that other APRNs face? I mean, like even, barriers to getting done what you need done or barriers in communications or anything like that.
Yeah. One of the big barriers is that ultimately the attending physician um, and I respect my physician colleagues very much. They go through a lot more education and training than we do. There's a reason that their scope of practice is larger than ours, and
Hmm.
it's because of their education and training.
Yeah.
But there are times that we disagree on the plan of care, and ultimately, because they are the attending physician, what they want goes. We have a great reputation and we have a great rapport with our physician colleagues, so we definitely have a discussion about things, but that can definitely be a barrier as far as like being good stewards of our resources. Um, we may not be as aggressive with obtaining certain labs or things because we focus a lot on resource stewardship in our training. So, what are we going to do with this piece of information that we get? Is it just to satisfy our own curiosity, or is it going to change the plan of care? Because if it's not going to change the plan of care, then it's not really fair to charge a patient for a service that's just for our own personal curiosities. And it's also resource intensive. Even if you send a lab, someone has to process that lab. If that lab comes back abnormal, someone has to own that and do something about it. So um, that can be challenging. Um, I think here we have a lot of respect among our physician colleagues, but definitely in other institutions, there's some disrespect
Yeah.
on APPs.
Hmm.
They don't believe our training is adequate for what we do. But I think that the way that we collaborate with our physicians here is completely appropriate, and we have a great amount of autonomy, but not so much that we're practicing outside of our scope.
Yeah.
And I think here our colleagues recognize that and agree with that, but in other places it can be a lot more difficult.
Yeah, it makes sense. I mean, Ohio State specifically has just got such a large volume of patients, and so I'm sure the physicians feel very overwhelmed by like that volume and having to manage each one of them individually. It just seems like it would be too much. So I
Yeah,
understand how
yeah,
in maybe a smaller hospital it could be different or a different
yeah.
hospital. And just the last question. So you're talking about some of the barriers that you faced. As an APRN, what would you like to see? What changes would you like to see made for APRNs?
I think um, here it's different at every institution, but here at OSU, we do not compensate more for a doctoral degree.
Hmm.
And I think if we want to advance the practice, we really need to push for advanced degrees and advanced professional degrees.
Hmm.
So I think but if you're going to get paid the same for a master's degree versus a doctoral degree, there isn't as much motivation to pursue that higher level of education because it does take extra time and extra money to get that doctoral degree. So I think that that should be compensated.
Yeah.
Um, we're working on this, but I would like to see more professional development and education for our APPs. Um, that's something that we're working on, making sure that not only is there opportunities for education, but also that people have access to those opportunities.
Yeah.
Um, as far as like staffing and such, like
Hmm.
you can't go to a conference if you're having to cover the floor at the same time. So making sure that everyone has the opportunities to get that education, both for the educational benefit, but also for the benefit of exposure of APPs and what we're doing. I also would like our team to be more involved in quality initiatives or evidence-based practice research initiatives. We have an APP conference once a year here, and we really highlight a lot of what our APPs are doing. They present posters or do podium presentations based off of their research, evidence-based practice QI initiatives that they've done. And I would like to see more of that in physician spaces as well, just to enhance the reputation of our APPs as well.
Understandable. Proving your worth. Definitely
Exactly,
worth a
exactly.
lot.
Yeah.
Well, that's all of the questions I have, and I thank you so much for taking your time to do this for me. I really appreciate it, and I
Yeah,
learned a lot
anytime.
about your job. Even though we have worked together before, I appreciate learning more about what you have to go through, especially with your resources and things like that. That was very interesting to find out more and knowing why you kind of work the way you do. And so yeah, I really appreciate it. I look forward to talking to you at a different time. Thank
All
you.
right. Thanks. Bye.
Bye.